Good afternoon. This is Dr. Bill White again with the American Orthodontic Society, and I hope that you're getting something out of these videos that we put out, and I hope that they help people all over the world, wherever they go to. I want to talk to you a little bit about this afternoon about trading the wisdom teeth for buys, or trading the buys in and getting some wisdom teeth. And there's several more nice things happen by doing that. So it's not just trading the buys for the wisdom teeth, but you get several other things out of this case. If you watch it, I think you'll enjoy it. And I'm going to go ahead and get started here. Here's a young lady that we took back in the early 70s, and this is not too good a picture. She's got a little fullness in the face and a little bit of extra vertical dimension in the face. The young lady has a protrusion of the upper front teeth, and there's probably about a 10 or 12 millimeter overjet there in a class 2 form, and she's got a lower jaw that's dropped back quite a ways underneath there, so you have to flatten the arch out and bring it forward. All the typical things with class 2 division 1 cases on both sides. So the lower teeth fit right up underneath the upper teeth in here, and I don't know, this distance from here to here, when you look at it from the side, looks like about 10 or 12 millimeters. And in her particular case, we're going to take out the bicuspids right here, the upper first bicuspids, and I think it was the lower, may have been the lower second bis. So you can bring these teeth back faster if you take the first bis out, and the posterior teeth can move forward faster if you take the second bis on the bottom arch. That's kind of the thinking behind that. That's not absolutely necessary to do it that way, but anyway, I'm pretty sure we did it that way. Now, let me erase that, and we'll go on to the next one. And yes, that is what we did. The second bis on the bottom and the first bis on the top, and we took some deciduous teeth along the way. Now, this is 1974. This is a few years ago. To me, it doesn't seem like very much, but to some of you, you weren't even born back then. And this young lady is 12 years of age at this point. This is the first video we've taken, and you can see the overjet is quite a bit in here. And so we're going to try to advance this. Now, when you look at the profile from the side, it'll look kind of tapered, and you take class 2 cases that are very bad, and you'll have the upper anteriors will just be almost straight up and down, and the lower anteriors can be like this. And then class 3 cases, it'll reverse, and these will be sticking out like that, and the lowers will be leaning back. So you can taper the front teeth and get people to look quite good, though they have a short lower jaw. You do it this way. If you've got a protrusive out here, you do it the other way, and you can keep the teeth interdigitating, and that is a kind of a trick you might want to learn from this. We'll show it in a little plainer in a few more pictures on down the line here. All right, looking at it from this side, both sides are back like that with a terrific overjet. and you would think that you just can't get this to look good, but I think you'll have to agree this looks quite good when we get down in the nitty-gritty of the end of this. And we save all of the wisdom teeth. She has 4 6-year molars and 4 second molars and 4 wisdom teeth when we get through with this particular case. Now, this was done back in the 70s, and we were in bands back then. And if you haven't experienced that, you're just lucky. It was a lot more difficult doing orthodontics with bands. It looks like this was a small lateral tooth. We had to almost crimp our own band to get it to fit that particular tooth. Then, and sometimes we did really had to just make a band. Okay, that's just regular orthodontics. Now we had to flatten the arch because the teeth were up here, so we're going to flatten it down, and we're going to bring the lower jaw forward and fit it underneath there. And we took the teeth out and started getting with it on the case. This tooth is not all that terribly narrow, but it is kind of tapered off up here at the side. It's not as squared off as this one on the other side of the mouth is. Okay, now the space on the bottom we're closing by bringing the 6-year molars forward up against the first bicuspids. Now the first bi is not quite as nice a tooth as the second bi. The second bi looks more like has a lingual cusp. The lingual cusp on the first bi is pretty small in here, and that's a little drawback from doing that. But it's quicker bringing these teeth forward on the bottom, and that's what we wanted to do. And we brought those forward and closed that space and brought the lower jaw forward a little bit, not too much. It's mostly tilting the teeth. Alright, here's the facial structure in 1975, and you can see the chin is not out as far as the maxilla in both views there, and we're using a cervical headgear, which we can run this bar up here, and it kind of brings the molars back. It tilts the molars and brings the root of the molars back, pulling from the neck side in here. And you take somebody with a bad problem like this young lady had, they willingly wear the headgear like this. These slides along here are just regular orthodontics, and we're closing the space on the bottom from the back to the front, and up on the front, the upper from the front to the back, and that makes this type of case come out better, and we'll have the upper front teeth almost straight up and down, and the lower front teeth will be tilted back quite a bit. Okay, here we go. Now let's see, something else has gone wrong here. I'll have to get this little dot formed again. Okay. Now we're closing the upper from the front to the back and the lower from the back to the front in there to get this. Now we've got the lower space closed up pretty good, and it's looking quite good. I'm going to run through these pretty quick. They're not, that's just regular orthodontics, and we opened the bite, and we brought the lower jaw forward now, and it had an overjet and a complete closed bite, and it's looking quite good at this point. And we have this lacing in here, and class 2, and we're in class 2 elastics, and we go through this pretty fast. And there's the class 2 elastics pulling that together. And we're getting closer and closer to what we want. This is 1976 now. And we've got all these bands on. So you remember, we want to have a little more torque in the teeth when you have bands, because you're going to close this band space, and that's going to reduce your torque. You can be out here and you close it, and it'll come back, and you'll lose some of the torque you have in the teeth. Okay, we'll go on through now. We're closed up pretty good, and it's 1976. We started in 74, and now we're going to take the brackets off, of the bands off. Now this decalcification was on those teeth when we started off up there at the top of the centrals and everything. And it's lined up back in place pretty good, really. Okay, let's go ahead and we'll finish it out. And I want to show you the panorexes, and we'll go through a series of panorexes. And now this is interdigitating very good. This is the class 1 all the way back. You notice how the 6-year molars lean back, contacting the second molar back here. And this is the band still on that tooth, and that's a tube on it right there, and the second molars lined up back on that. Now let's see what the next deal. We've taken the bands completely off the upper, and this is in 1993. This is from the time we started it in about 74, I believe, or 5. In other words, it's 20 some odd years later. Here is the young lady, and this decalcification is kind of discolored a little bit, but not too much, and the teeth look quite good. And here we go on the other side. This is 4 of 77, and here is 2 of 93, 77, 87, 93. So this is several years after finishing the case, and it's still holding up that good. And looking from here back, I got a lot of decalcification. Looks like some decay in that right there. Some stuff that ought to be worked on. That's 1977 though, and we'll look at it in 1993. And apparently they didn't do much. There was no decay in here, so it is from 77 to 93. It's about 16 years, something like that, I believe, if my math holds up. And you notice how we've allowed these teeth to erupt into each other, and how much better they look years later. In other words, from 93 to 77, that's about 16 years it's been in there. And this is the 6 keys of the occlusion right in there, the way those teeth are meeting. Now this is a wisdom tooth, and that's a wisdom tooth back there too. So we traded those wisdom teeth. This lateral's a little narrow, and it ended up with a little space, but we got these teeth are interdigitated properly back in here. And the bites closed a little. Maybe that contributed to this space opening up a little during that period of time. Now here again in 77, we've got the bands on the 6-year molars here, and here it is in 93. We can fix our retainer, and of course the wisdom teeth came in, push that on up, and it's closed the space, and everything's lined up in here. And this is 16 years after we more or less finished finish the case back there. And this again, that's 77. And here it is in 93. The wisdom teeth are in there. So now we've got a little relapse in this area right here. I could have put a 3 to 3 over there and help hold that in place, but we didn't. So this we've taken out bicuspids. We have lowered the vertical of the case, and also we've lined it up, and the teeth have looked better in 93 and really than they were in 77. Well, this is 93 again, and there it is, and there it is in 93, I think, on the other side. Here's the young lady when we started. Her school pictures look like that. Here a little later, and there we started and took the teeth out and pulled them back and changed her facial structure. That's 1976, I believe. Sorry for the pictures. I think this is some school pictures she brought me. And here she is again, 1976, 70 something there. Now here she is a little bit older. Now you've got a kind of a tapered face, you see. Now let me show you how the teeth come out, but the facial structure looks good. Now this is in 93. She's matured. She still has that same angle in here. The facial structure's changed some up in the forehead. But here she was in 79, I think that's 79. And here it is in 93, and that's 70 something. And here we're in 93. So this girl with this big overjet and overbite is looking good years after we get through. Now, there she is, and you remember what she looked like back when she was a kid in school. This is 74. The teeth were sticking out like that. Now these teeth are straight, pretty much straight up and down, and these upper anteriors are laying flat down. I mean, they're just flattened out when we start the case. Now what's the difference in these teeth as we go along here through these different steps? Alright, this is 74. Here's 76. You see, we took the teeth out and we moved the back teeth forward, and the wisdom teeth are in and everything down here. Now these teeth are laying at an angle, and these are more or less straight up and down, and the facial structure looks so much better. Now let me back up and see the way the teeth were to start with. The lowers were straight, and these were laying, the uppers were laying down like this, and we changed the deal like that. And you can do that, and the facial structure looks pretty doggone good, really, though we didn't lengthen the jaw or anything like that. Of course, you can't make the thing grow any. We can advance the mandible and keep it out there, but it's a real pain. Sometimes on adults we do that, but they have to keep it there for 15 or 20 years before the condyle and everything will just in the fossil adapt to the new position. It's not very easy to do that. So here we are with the new position, and the facial structure looks good in that position. And here it is in 93. This is out just a little bit. It's not as straight as it was, and this is lined up good. And so in 93, It even got better. In other words, we got her functioning correctly, and it'll improve on what it was. So there's a lot to learn in something like this. I'm sorry I had such a hard time getting started with it. Okay, here's the age 13. This is in 74, and we take out the lower second bicuspids and the upper first bicuspids. In doing this, it was very crowded, and we took those teeth out. Now, some people just condemn removing of teeth, but they don't condemn extracting wisdom teeth, which are excellent teeth in a good chewing position. And they think nothing of that. It's just what we've been taught. A wisdom tooth is made at the same plant that makes the other teeth, and they're just as good, and they're in a better chewing position than any tooth in the mouth, because they're right over where the muscles are. You know, you can chew harder back in there where the wisdom teeth are. So they're excellent teeth to keep. Sorry for that. Let me see if I can get back here and reduce that. Okay. All right, here's the first and second molars. Now on the bottom are banded, and you can see where the wisdom teeth are coming. These are 12-year molars, and she's age 13, see? This one is in. This one's not quite in over here, but that's okay. She's just, but see where the wisdom teeth are. Now look at the wisdom teeth here, age 14 and 76. All right, here we've got the 12-year molars in, both on the upper and the lower, and this is 1976, and we've taken the braces off. Really, we don't have anything else on her, and we're waiting on the wisdom teeth. Now, if those wisdom teeth came in and they were leaned over, we can upright them just quite easily. So I don't worry about that. So these came on in, and we assisted them maybe to get them in place. Now here they are. Let's see, this was 76. So from 76 to 93, and here are the wisdom teeth in 93, which is 16 years later, and their teeth have lined up like that. The bite's closed a little bit here, and the lower crowded slightly, but very little. And this is, I think, a darn good trade. You traded a bicuspid in here for a wisdom tooth back here, which is right in the chewing area of the muscles. And so I think this is a good trade. So I'll defend the removal of the bicuspids in a case like that. So I'll have to hush here. I'm sorry, I've got a cough and my throat tend to tie up in this. So anyway, I'll hush and thank you for watching. I hope you'll join our group now and subscribe to our channel. Thank you a lot now, and I'm going to close it out. Bye-bye.